you're 19 weeks pregnant, you probably have a lot of questions like, when am I going to start feeling the baby move? Are we sure about the baby's gender? How is the baby doing? What changes is your body going to go through? And what should you expect at your next appointment? We're going to talk about all of that right now. But first, if you're new here, you're watching in the Health and Medical Zone. And if you're new here, in the Health and Medical Zone means in good health and spirit. So if you like being healthy and happy, click subscribe because you are in the right place. So, at 19 weeks pregnant, you're in month 5 of your pregnancy. You only have 4 months to go. Or, if you like to count by weeks, you have 21 more weeks left, so you're almost at the halfway mark. Your baby is about 6 inches long and weighs around 8 ounces, roughly half a pound. At this point, your baby is starting to develop a protective layer over the skin called vernix. Vernix is a cheesy, oily-like substance that acts as a barrier, protecting the baby's skin from their liquid environment. You know how your skin gets all wrinkly if you're in the bathtub too long? Well, vernix is what keeps your baby's skin from getting all wrinkly. Most of the vernix disappears as they approach full term. But when you see the baby come out with that white stuff all over them, that's what you're seeing, especially if your baby is born a few weeks early. As for you, by now, you'll almost always be showing at least a little bit. If this is your first pregnancy and you're very thin, you may just barely be showing. But if this is at least your second pregnancy, you're probably showing even more. If you've switched to maternity pants already, that's totally fine. If you're still in that stage where you can wear your regular pants but can't zip them up anymore, I highly recommend a maternity band like this one. It's great for that in-between stage where you're still wearing your regular pants but can't zip them. Maternity pants can feel really big, so a band is a nice option. And they're useful again after you have your baby when you're transitioning back into your pre-maternity pants. On a side note, when that time comes, be patient with your body. Give it time to heal and lose the weight. You might also be starting to feel the baby move soon. This is called quickening. For some, those early baby movements feel like butterfly wings fluttering in your tummy, and for others, it might feel like a gas bubble. On average, women start to feel the baby move between the 18th and 22nd week. So if you haven't felt anything yet, no worries, it's going to happen in the next few weeks. Some women start to notice a few aches and pains around this time. If you're having lower abdominal pain or back pain, first of all, make sure to talk to your OB about it. But if you want to learn more about round ligament pain and low back pain, which are pretty common during this stage of pregnancy, check that out if you're dealing with it. But today, I want to talk a little bit about leg cramps. They're the worst. Okay, so leg cramps, this is when the muscles in the back of your calves or in your feet involuntarily contract. It's pretty painful. We actually don't know the exact cause. It could be the extra strain of carrying a baby, dehydration, decreased blood flow through your legs because of your growing uterus, or a combination of all of these. Leg cramps usually happen at night, typically during the 2nd and 3rd trimester, and they can wake you up out of a dead sleep. The way to get rid of it is to straighten out your knee and flex your ankle and toes toward you. If you have a partner or spouse, they can help you, and I highly recommend showing them what to do ahead of time so that when it happens, they're ready. Here are a few things you can do to help prevent leg cramps. Stretch before bedtime. Continue exercising regularly unless your OB advises otherwise. Stay well hydrated. Eat magnesium-rich foods like nuts, seeds, whole wheat, and beans. You can even try a magnesium supplement, but talk to your OB first. There's some limited data suggesting it might help. You can also consider calcium supplements. Again, talk to your OB first. I'm actually doing a video about leg cramps in the near future, so make sure you hit the notification bell so you'll know when it comes out. Alright, so now it's time to start thinking about prenatal classes, if you're interested. Not everyone takes prenatal classes, and it's totally fine if you don't. But especially if this is your first pregnancy and you're feeling nervous about the delivery, these classes can teach you a lot. You'll learn about relaxation techniques, laboring positions, your pain relief options, the stages of labor, potential delivery complications, newborn care, and lots of other helpful things. This is the last week that you can do second trimester screening for genetic abnormalities. I talk a lot about that in the week 16 video, so be sure to check that out if you haven't already. You can do that test up until 19 weeks and 6 days. Next week, I'll be talking about the big 20-week ultrasound, where you'll see the baby's heartbeat for the first time, so definitely check that out. This is also when the baby's senses are starting to develop more, including your baby's hearing. Thank you for watching.